PRP means platelet rich plasma. In this procedure, usually this is done for rejuvenation. So earlier it was done for all sorts of rejuvenation like hair rejuvenation. It is also done in sports injury cases. Many big celebrities have also got it done. Nowadays it is also being used in infertility. So in infertility, basically we use it for low ovarian reserve patients. If we use in patients with recurrent implantation failure, recurrent miscarriages, in that we put it in the uterus. In patients with Asherman syndrome, and PRP is also nowadays being tried in male infertility, in azoospermic patients, in patients with erectile dysfunction. So it is still in the very nascent phase, but there are results. So many times PRP is clubbed with stem cells also. So it depends that what we are deciding for the patients. So basically now telling that how the PRP is done, because the patient gets very excited that how the PRP is going to done, what is going to happen to me. So basically there are two processes. One is like when you have got everything imported from outside, you have got all the consumables ready, and second one is when you are preparing it on your own. So if you want to prepare it on your own, there are chances that many of the things like is not as regulated, because the RPM has to be regulated, temperature has to be regulated. So in our cases we are using branded products and we are not taking any risk for the patient. So we have got branded syringes. We are not pulling it in plain syringes that are coming of 10-20 ml syringes. We are not doing that. So these are branded imported syringes. This is a double syringe that we are using. So in that we basically attach a needle to it. After it we open this cap. The needle pulls the blood from any vein. You can pull it. So 15 ml blood, basically 15 ml blood we are taking. Then we are closing this needle. This mouth is being closed. After closing it, we are very particular that these two edges are parallel to each other. And this is the machine we are using. This has been imported from outside. So we open the machine. Every time that you are doing it, it has to be like the two sides have to be the same. Because it is a centrifuge process, so you cannot put the other side has to be empty. If it is empty, that it will not rotate, it will not centrifuge properly. So now you close the machine and all the RPM, temperature, everything is set in this. So this is one of the best machines that we are using for our patients for making PRP. This is for the infertile patients that we are using it. Now you switch the button on. After switching it, it will spin and it will separate the PRP. So after that you unlock it, you take it out. The PRP is separated very nicely. Then you have to take it out very properly. Otherwise you just mix everything. You have to press it in the same manner. See, this syringe this plunger has come out. Then you have to rotate it in the anti-clockwise direction and it gets opened. And so your PRP is ready to be injected. Now in the same way as we do the ovum pickup, the patient is under short general anesthesia. We have made everything sterile. After that, we take it in the same way. Same needle is used, the same needle that we are using for ovum pickup, and we inject it from one of its edges. Just we put it and we inject it. And the PRP goes inside the ovaries. This is one of the ways. The second way is that we can do it laparoscopically. We put the laparoscope and through it we inject it in the ovaries directly. But the laparoscopic is very invasive and many patients, they don't feel comfortable about the laparoscopic procedure. But in cases when we are doing diagnostic lap histo, then in that cases we can club this PRP procedure with the lap histo procedure. But usually we do it vaginally. It becomes a bit difficult because the ovaries are quite small in size. But still we are trying it vaginally only. Basically we do PRP in patients with low ovarian reserve. So it is important for us that the eggs start forming, and in that cases we are able to go with the patient's own eggs. But it is not 100%. It's not that in all the patients this results come.